Video is going to be used to demonstrate the proper setup of the Baxter IV infusion pump. In order to utilize your Baxter IV infusion pump, you need to get the appropriate equipment, which consists of the Baxter primary tubing, the appropriate fluid, which is spiked according to policy and procedure, and if you require a piggyback, you need to get the Baxter secondary medication set. Spike it according to the policy and procedure again. Get the alcohol prep, and don't forget the IV hanger that's included in the set. You've already set up your proper IV solution and purge the tubing according to policy and procedure. Next, you hang it up. There is a bar on the side of the Baxter pump which is pushed and pulled open. Opening the door now reveals the tubing channel. The slide clamp is placed into the area after pushing on the red button. That opens the slide channel, and again this part is placed in directly into that area, pushed in. The silver knob is now pressed. That locks in the tubing, and you guide up the tubing through the channel around the bend. Now you may close the door. We are now ready to set the pump rate as dictated by the doctor's orders. First, we will turn our pump 1 on by pressing the orange button. It will go through its safety checks. Next, we want to set the primary rate for pump 1, so we need to push pump 1. Primary rate, that will be the rate that's dictated by the physician's orders. For this purposes, we will say 125 milliliters per hour. So push 1, 2, 5. Next, we have to set the volume to be infused. This will be primary VTBI, volume to be infused. Push on that, and for this purposes, we have our liter bag, so that's 1,000. 1, 2, 3, 1,000 milliliters. Now we are ready to connect it to the patient in the manner prescribed by the policy and procedure. Removing the safety cap, prepping the IV site with the alcohol that we're going to establish, opening the slide clamp, and then push primary start. The volume of 125 is now infusing into the patient. In order to stop the pump, we have to push stop. You may push the stop button in order to change a rate, or when your fluid bag or tubing need to be changed. Now come to the addition of our secondary medication. We have already gotten the appropriate piggyback and purged the tubing according to policy. Take the hanger, place it on, and place our primary bag so it is hanging lower. Next, we'll mount the piggyback. Have our alcohol prep ready. I have our secondary medication attached to the area that is before the tubing channel. We will now program the Baxter pump for the piggyback. Opening the slide clamp, again pressing pump 1, but now we're going to press secondary rate. Secondary rate is directed by the medication that you are giving. We will say that this is 100 milliliters per hour. So again, I push 1, 0, 0. And secondary volume to be infused, VTBI. I push that. And now I enter 50, because it's a 50 milliliter bag. And I push secondary start. When that is finished infusing, it will automatically go over to the primary amount to be delivered. So this video is going to be utilized to demonstrate this